Actually, 1 in 4 adults actually die of stroke across the globe. It's not a statistics which is part of India. But having said that, this is something like an epidemic which has to be addressed at a large level. And there has to be a focused effort in terms of addressing these kind of, I would say, clinical aspects which needs to be taken care. So MGM has always been forefront of addressing and taking leads in clinical areas. And that's been our forte. And that's been the vision of the company for the last 1 year of its existence. So this is actually a step towards ensuring that we actually are launching today a stroke hotline. The hotline is purposely designed to ensure a rapid response team activates within 10 minutes of the call being received, and we try to address this. So further details, I would request Dr. Sridhar and team to actually give us as due course of this program. But I would like to welcome all of you to this event, and thanks for joining us. And as we go forward, I think we'll hear more about this entire program and how we are planning to do it. So thanks for everybody to joining in and part of this August initiative by MGM Healthcare. Thank you. Thanks.
Thank you, sir. May now request Dr. K. Sridhar, the Director and Group Head, Institute of Neurosciences and Spinal Disorders, MGM Healthcare, to introduce the Stroke Rapid Response Team program.
Thank you and good afternoon. It gives me great pleasure to invite all of you here today. Today being the World Stroke Day, 29th October. Each year, World Stroke Day is celebrated or brings into focus the fact that stroke is something which we need to look at and increase an awareness about. We are gathered here today for the launch, like Mr. Harish Manian said, the launch of the MGM Stroke Hotline number and the unveiling of the MGM Stroke Rapid Response Team. The Institute of Neurosciences and Spinal Disorders at MGM has been delivering the best of patient care using internationally accepted processes and protocols. The concept of integrated neurocare, which has been implemented by us, involves seamless and unified care of any neuropatient in a multidisciplinary manner under one roof. Like you just heard, stroke occurs more commonly than one thinks. 1 in 4 of us anywhere can have a stroke. And it also happens to be one of the most common causes of death and disability in the world. Now, a stroke or a brain attack happens when blood flow to the brain is either blocked or when there is bleeding into the brain. Recognizing a stroke and acting fast is paramount to help either reverse or help a patient recover very well from a stroke. Now, why is it important to make this fast? This is because the brain by itself does not have the capacity to store any nutrition or oxygen, and therefore it is constantly needing the supply. Without a supply of blood or oxygen or nutrition, brain cells can die. And after a few minutes of stoppage of blood flow, brain cells start to die. And it so happens that approximately 30,000 brain cells can die every second of stoppage of flow. BFAST is the acronym which is used across the world to recognize the symptoms of stroke. But recognizing alone is not enough. We need to make sure that the patient does not waste time and reaches a hospital capable of dealing with an acute stroke in time. And that was the reason why we decided there has to be a dedicated stroke hotline which reaches the hospital and where the concerned team can respond to the patient or the patient's relatives in a time-bound manner. And that can help the patient recover. Now, even after a patient comes to the hospital, it then becomes our responsibility, the healthcare workers' responsibility, to treat the patient and restore the blood flow in the shortest period of time. And this can happen only when all the specialties who treat stroke and related to this emergency brain problem work together and in unison and seamlessly. This is the thought, and this thought also is an extrapolation of the concept of integrated neurocare. This has resulted in the formation of what we are launching today, which is the Stroke Rapid Response Team. This team has in it a large number of specialists of different specialities, like starting from the emergency physicians, the neurologists, the radiologists, the critical care specialists, the neurosurgeons, the interventional neuroradiologists, and all these people. Other than the dedicated nurses, the technical staff, the support staff, and the administrative staff, who all see that the patient gets the proper care in the shortest period of time. So when we receive prior intimation that a patient is coming to the hospital, the SRRT team is actually waiting for the patient to arrive. All the specialists are waiting there to arrive. And by actually having this process in place, we have been able to reduce the door to so-called needle time, to treatment time, to just under 11 minutes. And that is the shortest that we have done in this hospital. And when the world standards say that we can take up to 30 minutes. So this is something which shows that when we work like this as a team in a unified manner, working seamlessly, we can really do good to a patient and help them recover. We therefore, we are here to bring an awareness to the fact that things have to be done in the shortest period of time. And to help people do that is why we are looking at launching a stroke hotline number. And also, we have created this team of different specialities coming together, working on a platform which will ensure that there is no waste of time and that people deliver the best of patient care in the shortest period of time so that we get the best of outcomes in stroke. Thank you very much.
Thank you so much, Dr. Sridhar. We are extremely happy and delighted to have with us Thiru R. Sharath Kumar, who have joined us virtually despite his busy schedule. Sir, we request you to kindly launch the Stroke Rapid Response Team and Chennai's first stroke hotline number and address the gathering.
Indeed, I would say it's a great pleasure to be associated with the MGM Healthcare and especially Dr. Sridhar and the initiative taken by MGM. Let me inaugurate the hotline number for the Stroke Rapid Response Team of MGM. It's 044 4200 4200.
I unmuted, yes. Now can you hear me?
Hello? Can you hear me?
Professor Arjundas, yes, sir, we can hear you, sir. Thank you so much for joining us. We are in the process of launching the program.
Thank you.
And I take great privilege in launching it once again. Let me repeat it. The hotline number is 044 4200 4200. Stroke Rapid Response Team of MGM is open for all the critical care.
Yes, sir, we can continue, sir. Apologies for the confusion in between, sir.
Thank you for the opportunity, and I hope the hotline is now on, and people would need to get in touch immediately on emergencies. And this is the number once again: 044 4200 4200, the Stroke Rapid Response Team of MGM team. And thank you once again, Dr. Sridhar and the entire team, who have given me the privilege to be a participant in this event of today, which is of utmost importance. I would say doctors are in the noblest of profession, because me sitting in front of elite gathering of doctors who are listening in and who are present here, I think I was saved by a Dr. Jairam Pingley, the golden hour. When he met with an accident, the trauma care, of course, the golden hour in 60 minutes, any patient should be attended to. So likewise, it's now the SRRT, which is the short form of Stroke Rapid Response Team. Dr. Sridhar has very clearly explained the entire process and what is going to happen when the patient comes to the hospital. I think that is something like the golden hour, 60 minutes of trauma care patient should be attended to. Here, the entire team, the SRR team are going to be ready for the patient when informed that, of course, like doctor said, the neurologists, neurosurgeons, the emergency physicians, the critical care specialists, radiologists, neurointervention specialists, nurses and the support staff, the technical staff are going to be there. So, of course, your burden of, a certain amount of time, which normally people would think something may happen to the next of kin or the close relative or friend who has had a stroke. Well, let me not take too much of your time, but only thing I'm really happy about the initiative taken by MGM group and, of course, especially to Sridhar and the entire team. And one thing I would advise is, of course, there are so many reasons why anybody could get stroke. So in 1 in 4, doctor was saying, get strokes in the entire world. Well, I think the prevention is also there, I think, to be staying healthy. I think staying healthy is one thing which is very, very important. And smoking and getting into eating of sweets and getting diabetes of any kind. So I think these are the things which can be averted by keeping a very good health, sound body and sound mind. That is all I can say. That's the core importance today. Even during our COVID time, everybody says immunity is something which is needed to thwart this the virus from attacking anybody. So immunity comes from good health, and good health comes from maintaining yourself with regular exercises, and that is the basic prevention from even not being in one among the 4 of getting a stroke attack. And many people, doctors, come out with a very good booklet. I appreciate his wife and son who have been assisting him in getting this done. And தமிழ்ல வந்து பக்கவாதம் என்பதை எடுத்து சொல்லியிருப்பதும் நான் மகிழ்ச்சி அடைகின்றேன். ஏன்னா இது ஸ்ட்ரோக்குக்கும் ஹார்ட் அட்டாக்கும் நிறைய பேர் வித்தியாசம் தெரியாம இருக்கும். ஹார்ட் அட்டாக் ஸ்ட்ரோக் எல்லாம் ஒண்ணு நினைச்சிட்டு இருந்ததுக்கு முதல்ல ஸ்ட்ரோக்னா என்னன்னு விவரமா சொல்லியிருக்கீங்க. You really clearly, you written it down very nicely, explicitly, and very with clarity what is stroke and how the brain continuously needs oxygen and also blood circulation is very, very important. 20% of blood is definitely needed for the brain to function. So constant supply is needed, one through the spine, one through the front of the neck, and the arteries take the blood to the brain. And all this, of course, medical terms, because I've been in and out of hospitals, being an actor, having many injuries and going to the doctors. And well, I know many of the doctors were taking care of me. I thank at this moment Jairam Pingley, who operated on my C4, C5, and Mr. Murthy, the neurosurgeon in Apollo, Hyderabad, long back, about 35 years back, when I had a fall from 60 feet. I think I'm alive because of a doctor, and I thank the doctors. You're doing a great job, and you've done a great job during COVID times. And now I come to Sridhar. Sridhar, you're doing a great job, and the entire team. I congratulate you, and hope we can save many lives in the future years to come. Thank you.
Thank you so much, sir. Thank you so much for your words. And I'm sure that whatever you've said reaches the people on time, and stroke can be prevented with good lifestyle. Thank you so much, sir.
Thank you.
I now request Professor Dr. G. Arjun Das, the senior neurologist of our country. Sir has been kind enough to join us today for this event. Sir, over to you to share a few words.
Thank you, Dr. Sridhar. The people who get heart attack, they rush to the hospital to be within that sweet period that they can be treated. Now the same applies to stroke because of the new treatment. That is why the need for rapid response to a requirement of the patient. The stroke treated early can reduce the disability and save lives. But the main thing is there are very few stroke units. If a stroke goes to a general hospital, and if there is no stroke unit there, then it's not so useful. So the first point is that every hospital, major hospital, should have a stroke unit and a team that will be ready round the clock to receive patients. That's more important as patient reaching the hospital. Most of the time is wasted in writing stories. What is your age? What is your address? Then CT scan, When somebody is having a CT scan, then is waiting period. This is what is required in the hospital level. Rushing a patient is one of the most important things. Actually, in Western countries, they are going beyond that. They are giving treatment in the ambulance to save that much time. So earlier they reach the hospital, but if hospital is not ready, then it won't be so useful. Now we have many ready stroke units in Chennai. It was started in GH in 1990. Stroke, we got Indian Stroke Association. After that, many hospitals have got excellent stroke units. So my appeal is this rapid response must take the patient to a stroke unit. If there is no stroke unit, any hospital should be good enough, better than no hospital. So I think it's an excellent idea to start a rapid response team. But the rapid response team should be ready, and one hospital is not enough. There are so many strokes in the city. So you have to collaborate so that the patient can go to the nearest stroke unit. That's the most important. Thank you. Can you hear me?
We have with us Professor Dr. Vijay Sharma, the Senior Consultant from the National University Hospital, Singapore. Sir has been kind enough to accept our invitation to join us for this event at MGM Healthcare. So over to you, request you to share a few words.
Thank you very much for the invitation. This is a wonderful initiative to start a rapid response team. In medicine, time is of great essence in mainly three conditions. One of them is MI, what Professor Arjun Das told you just now. One of them is a road traffic accident, polytrauma case, and the next one is stroke. Luckily, we do not compete with cardiology because we need the CT scanner or the MRI scanner. So we compete with road traffic accident only, which is not that common when it compares to stroke. It's well known from our experience for last 3 decades that every single minute which we save for initiating treatment for a stroke patient, we are doing a great justice to that human being to provide him an independent life for future. The rough numbers are, if you are able to treat a stroke patient within 1 hour of symptom onset, you provide him 3 times higher chance of remaining independent in life. The moment this 3 hours becomes this 1 hour becomes 2 hours, it's no longer 3 times higher chance. It becomes only 2 times higher chance. When it reaches 3 hours, the number drops down to 1.2 or 1.3 times only, which is not a very big benefit. And this number keeps dropping very, very rapidly. The only solution to reduce, minute by minute. So we are racing by minutes. Minute by minute is to put a team together to identify patients fast, bring them to the hospital. I know Chennai probably will not be able to provide something like a mobile stroke unit where the stroke unit goes to patient's house, but at least if there is a place where every specialty is present, right from the word go, that will save a lot of minutes. And lot of minutes means that roughly 1 minute delay of treatment of starting a stroke or 1 minute prolonged time when the artery remains blocked, you are killing 20 lakh brain cells per minute. So even if we are saving 1 minute, we are saving 20 lakh brain cells. So it's a huge achievement actually what we can get. This is an initiative which is started by MGM. This is a great initiative. And definitely once it shows the success in terms of treating patients and having good functional outcomes, it will definitely be an encouragement for other centers. One center is not enough to deal with the stroke population. Other centers will be encouraged, and definitely the same model will serve as a standard of care for other centers in the country. Hearty congratulations for such a wonderful initiative, and I wish you all good luck for a great success in this. a great service to humankind by saving people's life as well as giving them independence. Thank you very much again.
Thank you so much, Professor Dr. Vijay Sharma, for your words of encouragement. I now invite Dr. Prashant Rajagopalan, Director of MGM Healthcare, to address the gathering.
Good afternoon, one and all. I would first like to thank our chief guest for today, Mr. Sharad Kumar, sir. Thank you so much for taking your time off your busy schedule and being with us this afternoon. And I would also like to thank eminent neurologist, Professor Dr. G. Arjun Das, as well as Professor Dr. Vijay Sharma for being here today on the occasion of launch of our rapid response stroke hotline number. Just a brief about MGM Healthcare. Inaugurated just over a year back in July 2019 by the Honorable Vice President of India. MGM Healthcare is a 400-bed state-of-the-art hospital with over 30 departments and 12 centers of excellence. Neurosciences headed by Dr. K. Sridhar and team will always be close to our heart and very special, being one of the first prominent teams to have come on board. And the kind of neurosciences that is practiced here, the integrated neurosciences, as Dr. Sridhar usually refers to, is a beautifully aligned system whereby a team of neurosurgeons, neurophysicians, neuroradiologists, interventional neuroradiologists, neurocritical care specialists, neuroanesthetists, as well as a support team of nurses and technicians work together as one single team. So the patient is treated as one single individual by a multidisciplinary team, which you don't find very often. And besides neurosciences, we also have another 8 to 9 centers of excellence. And in a very short span of time, these programs have got us both regional and national level visibility. And I would like to thank the teams for the same. I would also like to say that at MGM, patients are at the center of everything that we do. And I would specifically like to highlight, in the case of neurosciences program, the team is equipped with some of the best technology, including 3 Tesla wide bore MRI, which has noise cancelling, which takes away the fear of MR, which are usually quite loud, as well as a state-of-the-art biplane cath lab for neurointerventional procedures, including stroke, clipping, coiling, as well as state-of-the-art operation theaters with best-in-class navigation technologies, as well as operating microscopes. Besides which, we are very grateful for Dr. Ponaya and team to have put together an excellent neuroanesthesia program with one of the best critical care setups and a step-down ICU. On this occasion, I would like to once again thank all the friends from media, as well as our chief guests, to have taken their time and participated. I would leave by just reminding everyone MGM's stroke hotline number, 044-4200-4200. Thank you, one and all.
Thank you so much, Dr. Prashant. So we will now open up the floor for questions from the press and media. Request the friends from press to kindly unmute yourselves and start asking your questions to the panel here. We have a chat bot available on the Zoom module. Request you to kindly post your questions there as well. There is a question, sir, from one of our viewers. Can an individual experience stroke actually without knowing what's happening to them?
The symptoms of stroke are actually the broadly you can say BFAST, BEFAST. B is for balance, E is for any trouble with your vision or eyes, F is for any problem with your face, A is for any problems with your arms or legs, and S is for any problems with your speech. But as far as the brain is concerned, there are many other functions that a brain has, and sometimes even very, very mild problems with any part of your body may be the initial or warning symptom of a stroke. So in answer to the question, the answer is yes. Sometimes you may not think that you're having a stroke, but it may be actually the warning sign of a stroke. That is possible. But what I would like to tell people is that even if there is a doubt that is it a stroke, if that question comes into your mind, I think you must assume it's a stroke and rush, like Professor Arjun Das said, to a proper stroke center.
We have a question from VNR. Okay. Our stroke ambulance is equipped with CT scan to reduce the time to identify the stroke.
We currently do not have a CT scan inside the ambulance, but what we try to do is get as much information before the patient reaches us so that we are ready with whatever needs to be done. Sometimes medication like blood pressure stabilizing and other things is done in the ambulance by our emergency team, which travels in the ambulance, but we don't have a CT scan yet in the ambulance.
Doctor, this is Pushpa from the Times of India. I just have one question. I want to know how much time can this rapid response team, by how much time do you think you will be able to reduce from the conventional time of about 1 hour of something? How much time do you think this new facility can reduce for stroke management?
Okay. We are glad to say that we have already made it 11 minutes. Not from 60 minutes, from what is said 60 minutes, we have already made it 11 minutes. By getting our processes and protocols even more refined, we hope that we can reduce it further. But I think the crux of the matter is if we get an information beforehand, then it is very easy to be assembled in the ER and start the work so that we reduce the time and don't waste any time. So I think we have done 11 minutes and just a little under 11 minutes, but I think we can bring it a little lower. So the functioning of the rapid response team is by having proper processes and protocols in place so that at every step, a person or a specialist does not have to think or call the other specialist. The specialists are all there, the protocols are all in place, so it just goes from one step to the other. An analogy which I would like to give is like the pit stop or in the F1 race. You have about 10 people around the car and the tire change just happens in just a few seconds. Everybody's doing their work in a process and it just finishes. And the car goes back out of the pit stop. So I think that's how we have to work, and that is the crux of the whole concept of the stroke rapid response team.
So on this note, since Mr. Sharad Kumar has joined us and Sir is in the middle of his schedule, I request Dr. Ponaiya to propose the vote of thanks, and we will continue with our questions.
Good afternoon, all. So on this World Stroke Day, as we join the movement, I'm very thankful for the MGM management, Dr. Prashant, our director, Dr. Harish Manian, our CEO, for launching this Stroke Rapid Response Team hotline, 044-4200-4200. It is very important in stroke management as our eminent guest emphasized on that, which is much needed for a city like Chennai, because stroke is time sensitive, where rapid interventions in a facility with coordinated team effort improves patient outcomes. This has been proven beyond doubt. And to utilize that, we need to recognize stroke. Our media is here, people are here to help us in circulating the symptoms by which the stroke can be recognized. And more importantly, they need to get in time. And the current season, it's also important that don't stay home if it is stroke. Because staying home has become the norm whenever it's not essential that we should not move out. But if it is stroke, we should not stay home. And I thank immensely our senior neurologist of the country, Professor Dr. Arjun Das, for coming today and felicitating this event on the launch of Stroke Hotline. And also thank Professor Vijay Sharma, who is from the National University Hospital, Singapore, and who has mentored several stroke specialists across the world. And he has got a lot of publications on stroke work, and he has innovated systems to improvise the stroke care and improve the outcomes of stroke patients. Thank you, sir. Thanks for coming. I thank our chief guest, Mr. Sarath Kumar, for inaugurating this stroke hotline. And I thank our media friends for taking this message to the public, which is more important. And I thank Dr. Sridhar, Director, Institute of Neurosciences at MGM Healthcare, and all our healthcare staff and doctors for making this rapid response team, the stroke rapid response team, a successful model, and so that we can implement it and so that other centers can follow this model to decrease the time for interventions in stroke and thereby improving the outcomes of a lot of patients. Thank you, one and all. Thank you, everybody.
Thank you so much, sir.
Thank you. Thank you, doctor. Thank you.
Thank you.
Thanks to the entire panel, and thank you. And I hope we can save a lot of patients in our state and the country. Yeah, thank you so much.
Thank you, sir. So we have another question from the press. So the question is, do we have any investigations specifically that can identify a patient at risk of getting stroke? Any investigations?
See, there are medical risk factors which can cause stroke, which there are risk factors which can cause a myocardial infarction. Hypertension is one of the most important risk factors. Uncontrolled diabetes is another risk factor. And there are some genetic risk factors. There are some cardiac risk factors like irregular heart rhythm and conditions which can cause a stroke. So these are all some of the medical risk factors, and these are some of the people who are more prone to develop a stroke. And for them, a stroke prevention is very important. And more importantly, we have got also a stroke prevention clinic where your stroke risk factors can be modified so that your chance of getting into that 1 in 4 goes down.
We have a question from Ms. Pushpa. Can you tell us what will happen in the 11 minutes of rapid response?
Okay. So once a stroke is recognized or once our stroke hotline is activated, immediately you will be connected to the stroke coordinator. So what he will be doing is that he will be contacting you and he will be online all the time. And from our stroke team, they'll be communicating to you. They'll be sending the ambulance, and the paramedic will communicate to the stroke team on the base about the symptoms, about his blood pressure, about the sugar, so that we get basic information which is very essential to immediately start the interventions. So once we get these information and once we clear the what is called an emergency checklist, we need not even shift the patient to the emergency room. So how we achieve this 11 minutes is by bypassing the ER, which is a very innovative concept which can be done only in this kind of setup where there is a coordinated effort. So the patient, once we get the necessary information like the ER checklist, where the basic things are clear, the patient will be bypassed the ER and they'll be directly taken to a CT scan. And once the CT scan is done, and immediately the clot buster, which is called a blood thinner, which is administered to reverse the stroke. So this happens within 11 minutes. So once that is done, then we'll be looking for if any major vessel is getting blocked by a clot, and those patients whom a major vessel is getting blocked by a clot will be taken to the cath lab, and in the cath lab, our interventional neuroradiologist, the neurointerventional specialist, will put a thin catheter and remove the blood clot. So that is the most important innovation in medicine. If you see the last 10 years, this is the most important innovation in medicine, which has changed the life of so many patients, like Dr. Professor Vijay Sharma and Professor Arjun Das told you. This is the intervention. This is the modern intervention where the facilities are available in centers where the facilities are available. So this can be done. And the stroke, which was considered irreversible before 10, 12 years, is now reversible, and the patient can achieve a functional outcome. He can go back to his normal life. He can go back to his work. He can have his normal lifestyle and pattern even after a stroke if it is reversed completely.
So one more question, sir. As the city is expanding, how effective will the stroke rapid response team or the hotline number be if someone suffers a stroke 30 to 35 kilometers away from the hospital?
The answer to this is that we are just beginning the movement. Like Professor Arjun Das said, there are stroke centers across the city. The concept of the rapid response stroke team, like my colleague Dr. Ponnaiah just mentioned, is that one has to get the patient to the hospital fast, and in the hospital we have to work fast. That is the concept. So if you are far away from a particular hospital, you should see if there is a stroke team which has the capability of handling a stroke nearer you. Now, we have such problems in our society where sometimes there are stroke patients who are a little further away. We can sometimes ask those patients, or we are working now on a model where we can ask those patients to go to a nearby hospital where they can start the treatment and then perhaps come. But the best thing would be to directly go to a stroke capable hospital. That is the fastest way to reverse or recover from a stroke.
So just to add on to that point of yours, actually. So what we are planning to do as part of this entire network, we are actually, as all the eminent panelists just now mentioned, also Dr. Sridhar also mentioned, it is not going to be one institution's job to do this entire thing. So what we are trying to do is to create a network. This is, as I said, this is going to be the beginning. What we are planning to do is to create a network which covers entire Chennai region and the peripheries, with a more effective network of ambulance and remote centers which will be connected to this stroke hotline number. And from there, we will be able to mobilize things much faster, and we will be able to address the issue of people in a much more responsive manner. So the network will expand from here onwards. This is just the beginning. What we will actually see from here onwards for the next 1 or 2 months is to see this network expanding across Chennai, and this will become a model network which can actually save lives when it comes to stroke. So that's the objective of this program. This is not just going to be limited within MGM, but this will be a larger impact at a social level in Chennai as a region. So that's what we are looking at. And we will be having more partners to come in. Probably in the next meeting with all of you, we will be able to showcase our partner network hospitals also being part of this. And we would like to make a larger impact socially with this program, rather than just talking about stroke as just one niche area. So there is a larger impact which we are talking about as part of this initiative. And we will see this program growing from here onwards under the leadership of Dr. Sridhar. Thank you.
How different will SRRT be in terms of what other multi-specialty hospitals are offering on stroke?
There are many hospitals who are doing a great job in Chennai. What we are trying to do, and what our concept is, like I said in my talk, is that our model is based on an integrated neurocare. We all work together, whether it is neurology, neurosurgery, whether it's emergency medicine, whether it is neuroradiology or the intervention specialists, we all work together. Having worked together, the SRRT, I think, is different in that we are a protocol and process-based team. That being said, it does not depend on the individual who decides what is to be done next, but it's the process which takes it to the next step. And all the members of the different specialities already know that this is their job and this is where the next step comes in, and they are ready for that. So it is a team which works in unison, different specialities coming together, driven by processes and international protocols. And I think that is where we are trying to make things better for the patient, and so that the outcomes of stroke are better in society.
So we have a question from Mr. Jata. Even in cities which are well networked, the traffic could be a hindrance. Would it not help to have a mobile stroke unit?
So I would like to take that question actually. So Sujata, I think our suggestion is, as we speak, I think, retrofitting a CT scan today into any hospital. I think, Middle East and Europe has tried this model of retrofitting normal CT scans into a truck, which is very, very cumbersome, and trying to do that particular, model may not work so successfully because all that models have traditionally failed. So what we are trying to do is to look at a very, very small portable CT scanner, which we are trying to discuss and see whether it can fit into a conventional, ambulance, and we can mobilize it. That is one. Second, as I mentioned earlier, there is a network which we are trying to create within the city, which can actually ensure the call to attendance time is reduced dramatically. So there is a network which is going to be formed post this, which will come into forefront, and how this entire program will, run pan Chennai and pan this region. This can be a model network which we are trying to create. This is an honest effort. Let me put it that way. We are not trying to, promise something which is undoable, but this is very much doable. Considering there will be partner hospitals coming together, there is an, team of experts sitting in different locations working with us. So this will all spread to become a much larger initiative from MGM. Here again, the objective is to save life, and this number should become synonymous with saving life in Chennai. So that's the objective with which we are moving forward. The network is going to be created, and also we are looking at various modalities by which we can make this even more simpler. Why a CT scan in a machine? We can also talking about a small mobile unit, which is a two-wheeler unit, which will actually reach a patient's location when the call happens, and they can actually start administering initial care, and then that can be mobilized. So there are various models we are testing out as part of this initiative. You will see certain, tangible things coming out of this entire program in the coming months. So this is just the beginning.
Thank you, sir. So we have a question from Ms. Pushpa. When will we be able to initiate thrombolysis at home? What are the current challenges?
So at home, we cannot initiate thrombolysis. That is not possible now because we need at least a CT scan to initiate a thrombolysis. So to do the CT scan, in the present scenario, one has to reach the hospital within time. So there is no way we can treat a stroke at home. So this is the most important misconception which we need not have, because some people just, if they recognize symptoms of stroke, they just pop up aspirin or the blood thinners, whatever they've got as a regular medications, that only is not going to work. We need to reach the hospital because a CT scan, a plain CT scan is a bare minimum essential, which should be done before thrombolizing a patient. So we cannot thrombolyze a patient at home.
Another question is, how important is it for people to be aware of stroke symptoms and for person affected by stroke to receive care quickly? More on awareness.
Actually, this day, the World Stroke Day, has started off by trying to bring about an awareness about stroke. Like Mr. Sarath Kumar also mentioned, a lot of people think a stroke is a cardiac problem. Stroke is in fact a brain attack. And now many of us are trying to, when we talk to society, lay persons, we talk of stroke as a brain attack and not of actually, we don't use the word stroke because of the confusion. Having said that, it is important that everybody in society understands what a brain attack is and what the symptoms of stroke can be. And for that, we have the English acronym B FAST, which says B, if there is a problem with balance, that's for B. E, is there a problem with your eyes or vision? F, is there a problem with your face? A, is there a problem with your arms or your legs? S, is there a problem with your speech? If you have a problem with any of these, or even the minimal problem with any of these, time is not to be wasted. You must not waste time. It is time to call the stroke number or the hospital number. So this is the basic thing which is spread all over the world, so that awareness to lay public increases. And this is very, very, very important, that people must understand the symptoms of stroke and not think it is just some small thing which they should not, they can ignore or wait till the next day morning to see if it improves. Even if there is a doubt, you must reach the stroke-enabled hospital. And that is the message that we want to tell everybody.
Do we have any more questions from the press? So thank you everyone for joining us. On behalf of MGM Healthcare, we would like to thank the friends from press and media and our guests, our consultants, our other doctors who joined across the city and the country. We would also like to thank the panel here who joined us for this day, and wishing everybody good health and a great day ahead. Thank you so much.